Okay, ladies and gentlemen, we will start the next sessions. I will make sure that you are here for the presentations. The presentation number 8, Hari Wahyuningtyas. Can you answer?
Yes, I answer you.
Okay, thank you. And then the 9th presentation will be presented by Linda Presti Fibriana. Can you answer me? Are you ready, Mrs. Linda? Participant number 10, Ahmad Maftukhin. Can you hear my voice? Please answer me. Nur
Yes,
Rachmat.
Miss.
Okay, thank you. Nur Rachmat, BPO M.Kes. Are you there, Mr. Nur Rachmat? Number 12, Kustiani. Kustiani, can you answer me? Number 13, Nana Novariana. Nana Novariana, can you answer me? Number 14, Dewi Yuliana Radela Hervides. Okay, if we will start soon. If I call you for your turns and there's no answer, I will skip with the other presentations. Okay, ladies and gentlemen, we will start the second sessions, and please stay in the room until this discussion sessions. Don't go anywhere and monitor the questions in the discuss sessions. Okay, presentations for the 8 presentations will be presented by Mrs. Hari Wahyuningtyas. The time is yours. Mrs. Hari Wahyuningtyas, are you ready to present your research? Okay, for effectiveness the time, I will call for the next participant, number 9. Mrs. Linda Presti Fibriana will be presents the community empowerment through health promotion on preventing the spread of COVID-19 in East Java. To Mrs. Linda Presti Fibriana, the time is yours. I will continue for the next participant. The next participant number 10, will be presenting the analysis of factors that influence the quality of life of people live with HIV/AIDS in Dr. R. Sosodoro Jati Kusumo Bojonegoro Hospital will be presented by Mr. Ahmad Maftukhin. The time is yours.
Yes, thank you. Assalamualaikum warahmatullahi wabarakatuh. Honorable ladies and gentlemen, all participants, please allow my name Ahmad Maftukhin will present my research. The title analysis of factor, the define the quality of life, people live with HIV/AIDS in Dr. R. Sosodoro Jati Kusumo Bojonegoro Hospital. Next. As for the basic research, the high incidence of HIV/AIDS in Bojonegoro district is an issue that need to be a concern for all parties because people live with HIV/AIDS need support. This disease is chronic and requires comprehensive treatment. But the phenomenon in the community of people with HIV/AIDS is often isolated and socializing as caused by the patient outside and the surrounding community, so that the impact on the quality of life of patients with HIV/AIDS is less than the maximum. Next. Research Puspa, my research one, identifying the effect of ARV adherence on the quality of life of people live with HIV/AIDS. Two, identifying the effect of social support on the quality of life of people live with HIV/AIDS. Three, identifying the effect of nutritional status on the quality of life people live with HIV/AIDS. And four, identifying factor or most influence on the quality of life people live with HIV/AIDS. Next. Respondents of the study are people with HIV/AIDS in a population of 428 people. After calculating the size of the sample with formula solving, obtain the result of the number respondent 78. Sampling use the site probability with systematic random sampling technique. Next. The design of study was observational with cross-sectional approach. Find out the relationship between the effect of IOC consumption compliant, social support, and nutritional status on the quality of life people with HIV/AIDS. The date of both the independent and dependent variable were performed using an ordinal regression test with an alpha significant level of 0.05. Next. The measuring instrument used this study, the validity and reliability tests have been carried out and has passed the ethical test from both the Strada Indonesia Ethics Committee and the Bojonegoro Hospital Ethics Committee and the research area. Next. Thus, the result of the study show ARV consumption, compliance variable, and nutritional status variable do not affect the quality of life people HIV/AIDS because the significance value more than 0.05. Will the social support variable affect the quality of life people with HIV/AIDS? Because the test result of the significance value 0.000. Next. Discussing the result. As in this study show that the level of adherence to HIV consumption does not affect the quality of life people life with HIV/AIDS, where the statistical test result using the ordinal regression test, the significance level above 0.05, that is 0.223. According to the science, deterrent to unreasonable consumption is influenced by several factors. The first, respondent and productive age. As the general data in the study that diagram 4.2 can be seen that 75% are aged 18 or 15 years. With the productive age, they will try to maintain this physical condition by taking medicine regularly. Based the work factor where most respondents have the most work entrepreneur. Next. Two, there is not influence of nutritional status with quality of life people life with HIV/AIDS in the study. From the data from the research result and the statistic tests that have been carried out with the ordinary regression test have a significant number exceeding the alpha value of 0.005, which is equal to 0.498. According to the research, this because the respondent in stage 2, namely the asymptomatic state, so that people live with HIV/AIDS do not show symptoms, including weight loss, as stated by Nur 2007. Asymptomatic means that a body's organ do not show symptoms. The situation can last for 5 to 10 years. This healthy looking patient can transmit HIV to others. Next. There is an influence of social support on the quality of life people with HIV/AIDS, and the Sehati Poli Hospital Sosok Jati Kusumo Bojonegoro. This SPSS calculation result in the ordinal regression statistic test obtained significance to tell 0.000, less than alpha 0.05. One, the factor that influence the quality of life in support system, which includes support from the family, community, and physical facilities such as adequate housing or home and adequate facilities so that they can support life. Next. This is where families and people around people life with HIV/AIDS play an important role in caring for people life with HIV/AIDS. Families will get safe and always motivate a patient can increase positive perception of life and increase comfort in life, so people live with HIV/AIDS will value and care for. It is expected to improve the quality life people with HIV/AIDS. For of the three factors that have been studied, the social support that most affect the quality of life people live with HIV/AIDS. Next. Conclusion, this research, the factor of adherence to ARV consumption does not affect the quality people life with HIV/AIDS. In the Sehati Poliklinik RSU Dr. R. Sasodol Jati Kusumo Bojonegoro, Two, social support factor affect the quality of people life with HIV/AIDS and the Sehati Poliklinik Dr. R. Sosodoro Cadikusuma Bojonegoro. Three, nutritional status factor do not affect the quality people life with HIV/AIDS in the Sehati Poliklinik RSUD Dr. R. Sosodoro Cadikusuma. And the factor the most influence the quality of people life with HIV/AIDS in the Sehati Poliklinik RSUD Dr. R. Sosodoro Cadikusuma as a factor of social support. Next. This is documentation my research in RSUD with people live with HIV/AIDS. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much for Mr. Ahmad for presenting his results today. Let's stay tuned in this room for discuss sessions. Okay, we back to the 8 presentations. Participant number 8, Dr. Gigi Hari Wahyuningtyas M.Kes will be presenting the knowledge, family support, and role of friends of people in the attitude of traffickers in following the rehabilitation program in IPWL Bumbu Nusantara Foundation of Madiun City. To Mrs. Hari Wahyuningtyas, the time is yours. Okay, I think there are trouble for Mrs. Hari Wahyuningtyas. We will continue with participant number 9. She is Linda Presti Fibriana to present community empowerment through health promotion on preventing the spread on the COVID-19 in the East Java. To Mrs. Linda, the time is yours.
Okay, thank you, Miss Fitria. Assalamualaikum warahmatullahi wabarakatuh. Sorry, there was wrong room, so it must be missed. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning. Best wish to all of us. Thanks to moderator Miss Fitria. I will present my research with the title Community Empowerment through Health Promotion on Preventing the Spread of COVID-19 in East Java. Okay, slide. Background, coronavirus disease 2018, COVID-19 was determined by the World Health Organization as a pandemic, namely a disease that is transmitted global. The COVID-19 pandemic as a non-natural disaster has become even more dangerous if it is not addressed immediately, because experts have yet to find the most effective drug and vaccine. Okay, next. Data of April 29 obtained a case fatality rate of 6.09% in global, 8% in Indonesia, 11.1% is Java, on Jakarta 9.4%, West Sumatra 10.3%, and South Sulawesi 8.2% and Surabaya 14%. Efforts are made to improve community behavior in preventing transmission of COVID-19 by increasing the development of potential capability, so that capacity grow to solve the problem they face. This study aims to determine community empowerment through health promotion and preventing the spread of COVID-19 in East Java. Okay, slide. A method this research use a qualitative design. Data was collected through in-depth interview with due observation of health protocol and by using FGD or focus group discussion on 158 participants with Zoom meeting. Data we're analyzing using thematic analysis. Okay, slide. Okay, slide, moderator. The research show that to achieve a healthy state, a person or group must be able to identify and be able to meet needs and change or control the environment. Prevent the spread of COVID-19 by washing your hands frequently with soap and hand sanitizer and applying cough etiquette. Improve health with community movement, such as consumption of balanced nutrition, diligent exercise, adequate rest, and frequent washing of hands with soap. Okay, next. A conclusion, preventing and control of the spread of COVID-19 through health promotion by empowering the community of achieve a healthy state. A person or group must be able to identify and realize aspiration, be able to meet needs and change or control the environment. Thank you. My research to moderator Ms. Fitria. Thank you so much.
Thank you very much for Mrs. Linda Presti Fibriana. Sorry to correct the moderator in room 1. My name is Anna Trisnawati, not Fitria. Fitria is in the room 2. Okay, we will continue for the next presentations. What about the participant number 8, Hari Wahyuningtyas? Are you ready to present your presentations?
Okay, I'm ready.
Okay, please welcome, ladies and gentlemen, participant number 8, Dr. Gigi Hari Wahyuningtyas, M.Kes, to present knowledge, family support, and role of friends of people in the attitude of traffickers in the following the rehabilitation program in IPWL Bambu Nusantara Foundation of Madiun City. For Mrs. Hari, the time is yours.
Thank you for your opportunity, Mrs. Anna. I'm honored to meet you here. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all. My name is Hari Wahyuningtyas. I'm dentist. Call me Wahyu. Today, I'm going to present my research with the teacher Acknowledge family support and role of friend of people in the attitude of traffickers in following the rehabilitation program in IPWL Bambu Nusantara Foundation of Madiun City. Okay, background. The rise of illegal drugs such as narcotic can affect adolescents. If teenagers already use drugs, it's certainly very dangerous because it can alter their mentality and personality. External factors that cause drug abuse come from family, peers who are not good, wrong in crushing friends, and a less good community or environment. Divorce of parents, lack of communication between family members, or dispute between family members, family relationships are less harmonious, can trigger negative behavior among young people. I'm sorry, I can
Okay.
including consuming drugs, incorrect education in the family, such as over indulging children, giving religious education, or rejection of the existence of children can be a cause of drug abuse. The sign, I will make analytic with cross-sectional study. Venue and time at venue at IPWL Bambu Nusantara Foundation in Madiun City. Time 1 month in November 2019. Subject, total population of 160 respondents and a sample of 114 respondents taken by simple random sampling technique. And then dependent variable. It's knowledge, family support, and the rule of peers. Independence variable, attitude of drug user in participating. Analyze, collected by questionnaire. Data were analyzed by linear progression. My result, in partial result, effect of knowledge on attitude with a significant value of 0.00. The effect of family support and attitude with a significant value of 0.011. The influence of the role of peers on attitude with a significant value on 0.036. Simultan, result simultan. There is an effect of knowledge, family support, and the rule of peer on attitude with a significant value of 0.00. My conclusion, knowledge about drug is very important to be given early to anyone in order to understand more deeply about the risk and impact of drug consumption. In this case, the family is very important to monitor the association of family members so as not to fall into the wrong association with their peers. It's my presentation, my research. Thank you very much for your great attention. Sorry.
Thank you very much for Mrs. Hari Wahyuningtyas for presenting her presentations. Do not forget to write down your questions, your English question in the chat column, and we will answer the question in the discuss sessions after the 7 presentation already given the presentation. Okay, for the next presentation will be presented by participant number 11, Mr. Nur Rachmat PPO, Magister Kesehatan. The title is Analysis of Factor Affected to Prosthetic Users' Quality of Life. To Mr. Nur Rachmat, the time is yours.
Yes, thank you very much, Miss Anna. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Rachmat, and my research team is Professor Muhammad Fanani, Professor Dasono, and Professor Suwarto. This is my research entitled by Analysis of Factor Affected to Prosthetic User Quality of Life. Prosthetic user is a patient, amputation patient who use prosthetic or artificial limb. The background of my research: an amputee is a person with a disability who needs special attention because the condition of the amputation they are experiencing so that it disrupts their quality of life. So there is the amputee, and because the amputation they lost their limb, and because they lost their limb, it disrupt or it's make their quality of life difficult. Amputees use prosthetic for daily activities. It means that some amputees they use prosthesis. Prosthesis mean artificial limb, or Indonesian people call kaki palsu, for daily activities. The quality of life of a disability is collection of multi-dimensional concept of emotional, cognitive judgment about one well-being, life satisfaction, enthusiasm, and happiness. Thus, the quality of life of a person is best assessed by the person himself. Therefore, many aspects need to be considered to assess the quality of life comprehensively. Next, please. Next, please. Yes. This study aim is to conduct an analysis of factors affected to prosthetic user quality of life. Those factors are: first, motivation, self-efficacy, religiosity, optimism, social support, and subjective well-being. Okay, this motivation assessed by an intrinsic and extrinsic. Self-efficacy is assessed by level, generality, and strength. Next, please. Next, please. The religiosity is assessed a ritual dimension, ideological dimension, and intellectual dimension, experience dimension, and consequence dimension. While optimism is assessed by permanent and also pervasive and personalization, while subjective well-being can be assessed by life satisfaction, affective. Next, please. Next, please. Next slide. My research method. This is a quantitative research using observational analytic. It is a cross-sectional design. The population is transfemoral prosthetic user in hospital clinic using simple random sampling technique. There were 110 samples using structural equational modeling with AMOS software. The instrument is questionnaire, and the independent variable are motivation, self-education, religiosity, optimism, support, and mediating variable is subjective well-being, while the dependent variable is quality of life, which is carried out simultaneously by filling out the questionnaire. Next, please. Next, please. How about the result? The result is already conducted in 2019. 110 respondents filling the questionnaire. The questionnaire already valid and reliable, and the model proposed is good fit. And it is indicated that the C-mean per degree of freedom is 1.360, which indicate that it is a good fit model that require the criteria. Next, please. Okay, this is the description of the respondent. There are majority is 62 male, and 48 female. The age are shown in the diagram, and the religion mostly are Islam, occupation mostly are entrepreneur, education mostly are, you can see in the diagram, and mostly are married. Next, please. Next, please. This is the pie diagram, which is done in the research. You can see, and then this is direct effect of the test result. Okay, okay. This is the pie diagram. You can see the arrow from the exogen and endogen variable. Please next. Next slide, please. This is the direct effect test result. You can see all are the motivation, self-efficacy, religiosity, social support, optimism, which have direct influence to the subjective well-being, while the optimism, motivation, religiosity, social support also have direct effect to the quality of life. The p-value is 0.000, which is this is very significant. Okay, next. Next slide, please. Next slide. Okay. Okay, this is you can see that the conclusion of this all the variable have the positive influence to the subjective well-being. Next slide. Next slide, please. Okay, I think the slide is while the indirect effect result, you can see there are motivation is also having indirect effect to the quality of life, which is through the subjective well-being, while the self-efficacy, religiosity, social support, and optimism also have indirect effect to the quality of life. What is the mediating is that is subjective well-being. The p-value is 0.00 each of them. Okay, next. Next slide. Okay, the influence of the motivation that is also shown in the diagram. I think you can also next slide for this. Yeah, this is also all this as you can see, number 5, that is effect of the optimism on quality of life prosthetic user through subjective well-being. That is you can see from the table before, that is from the Sopel test. The GR value is 4.504, and that means that there is a effect of on the quality of life in prosthetic user through subjective well-being. Okay, next. Next slide. Okay, this research is in line with some of the research, which is from Warsia, from Darmita, from Ademo Adare. I can see that, suppose the last one, the emotional intelligence, self-efficacy, religiosity affect adolescent subjective well-being. These are some research which is in line with the research which I have done with the team. Okay, next slide, please. This is also the another research which is also the same and in line, that is social support can come from the environment, friend and family, parent, and also from the Peterson said that social support has a beneficial effect against stress of psychopathology. This from the speed and improving subjective well-being of disabled patient by Horny and positively related to poor quality of HRQL by Peterson. Next slide, please. Next slide. Okay, this also other research which is in line about the subjective well-being, and this means that the better quality of life of people with disability is due to their real work in life, in daily life. Quality of life is provided an opportunity to live comfortably, maintain psychological condition that must be balanced with psychological condition in everyday life. Improving subjective well-being will make better the quality of life of the prosthetic user. Next slide, please. The conclusion, the prosthetic users need to improve their quality of life. This is the conclusion. The prosthetic user or the amputee who use prosthesis is need to improve their quality of life. By what? That is increasing the value of the motivation. Improving self-efficacy will improve their subjective well-being. The prosthetic user need to be optimistic. Prayer and belief in religion, which is part of the relationship, will help to improve quality of life. Which means that if the people have good religiosity, they will improve the quality of life too. Social
Mr. Nur
support
Rachmat,
from friends and
your
families.
time just 1 minute left.
Okay. Social support from friends and family is required to help prosthetic user to improve their quality of life. Where with the good subjective well-being, a person will be able to face all the problems that occur to him, never give up, and fulfill his needs. Subjective well-being is mediator to improve the quality of life of prosthetic user. Okay, thank you very much for all your attention. Thank you very much, and I give back to Miss Anna as moderator. Thank you.
Thank you very much, Mr. Nur Rachmat, PPO, Magister Kesehatan, for presenting the research. And I remind you again to make questions in column chat so we can discuss in the last sessions. Okay, I will call the next participant number 12, to Mrs. I. Kustiani. Please welcome to present your presentations about factor related to COVID-19 patients in Abdul Muluk Hospital, Lampung, Indonesia. To Mrs. I. Kustiani, the time is yours.
Okay, thank you, the moderator. Okay, I'm I. Kustiani from Mitra Indonesia University. We'll present about our paper is factors related to COVID-19 patient in Abdul Muluk Hospital, Lampung, Indonesia. Next. Nggak ada apa. Okay. Introduction. COVID-19 has become one of the pandemic cases in the world based on 12 March 2020. And on 29 March 2020, cases of the coronavirus have reached 634,835. It's increased. And in Indonesia, based data on March 2020, 1,528 cases affected by the coronavirus. And there is 36 who died. Next. The data in 12 August 2020 that those who were positive for corona were 130,718 and those who died were 5,903. This is data from Ministry of Health 2020. Next. Okay. The virus can develop rapidly and can cause serious infection to death. Everyone has the possibility of contracting the coronavirus. The older a person is, the higher the chance of being exposed to the coronavirus due to a decrease in the immune system, which function as body protector. World Health Organization on 2020 state that males' biological characteristics and response are different from females, and so that there are differences in the likelihood of contracting the coronavirus. Next, in Lampung province, Lampung is a border area and a connector between the island of Java and Sumatra. It has a high probability of cases of the coronavirus due to transmission from other areas. And the data on 12 August 2020, the suspect corona case reached 62 with 20 confirmed cases and 13 people died. Next, COVID-19 patients in Lampung are treated in Abdul Muluk Hospital, which is a referral hospital located in Lampung's capital city, Bandar Lampung. And research on factors related to incidence of COVID-19 in Lampung has not been widely carried out. So, the purpose of this study is to determine the factor associated with the incidence of COVID-19 at Abdul Muluk Hospital, Bandar Lampung, Lampung, Indonesia. The design of this study is cross-sectional study, and the population 111 COVID-19 patients in Abdul Muluk Hospital, and the sample is 98 patients. The inclusion criteria were COVID-19 patients who were treated at Abdul Muluk Hospital and which had complete data. The dependent variable is the incidence of COVID-19, and the independent variables is age, gender, and history of comorbidities. The time, this research takes from April to July 2020, and the analysis univariate and bivariate analysis. Next. Okay. Here are the results. Seen from table 1, the descriptive data of COVID-19 patients, it can be seen that the most aged were as old 14 years or above. Male gender 16.2% and 15 for respondents having history of comorbidities. Next. And this is table 2 about relationship of age, gender, and history of comorbidities with COVID-19. From table, shown that the most age of COVID-19 were as old 14 years or above, and they will have history of comorbidities. And bivariate analysis shown that p-value less more 0.05 means there is a relationship between age and history of comorbidities with COVID-19. Based on the results of the research above, it was found that the most COVID-19 patients were as old 14 years or above, with a percentage of 36.9%, and patients under 14 years of age was 36.2%. Osama et al. 2020 states that the coronavirus can affect anyone and the risk of contracting the coronavirus increases when the age is over 14 years. Cagnasi et al. 2020 shows that the incidence of death due to coronavirus increased over the age of 30 until 39 years. Age over 14 years is an age that is more prone to disease because at the age, it experiences various processes of declining in various aspects, such as decreasing hormone production, skin elasticity, strength and function of organs, bone density, and an immune system that does not work optimally.
Mrs. I, your time, 1 minute left.
Okay. Next. Okay. The data from the results of the study show the most COVID-19 patients were men, and veteran and all 2020 state the men are more exposed to coronavirus because men have low hand washing habits, higher smoking rates, and other sporting diseases such as heart and respiratory disease. Next. Next. Okay. And the conclusion of this study was the most COVID-19 patients from the result of the study were male with age same and over 14 years. Most COVID-19 patient has a history of comorbidities, and the result of the bivariate analysis test results show a significant relationship between age and history of comorbidities with COVID-19 in COVID-19 patient. Okay, thank you.
Thank you very much for Mrs. I. Kustiani for presenting her research. And now we will continue with participant number 13 to present. The participant is Nana Novariana Nur Sefa Arief Hermawan. Please welcome to Nana Novariana Nur Sefa Arief Hermawan with the title, The Influence of Knowledge to Hand Washing Behavior in the Prevention of COVID-19. The time is yours.
Hello, check. Honorable moderator and all participants, good morning everyone. Thank you so much for Strada Indonesia for this moment. I will join the second Strada International Conference on Health. I'm very happy to have this chance to give my presentation. Okay, before I start my speech, let me introduce myself first. My name is Nur Sefa Hermawan. I'm lecturer in Program Study of Public Health, University of Mitra, Indonesia. Today I will share my presentation with title is The Influence of Knowledge to Hand Washing Behavior in the Prevention of COVID-19. Next. Introduction. In Indonesia, COVID-19 case was first discovered in March 2, 2020 with 2 confirmed data case. The number of COVID-19 cases in Indonesia continue to increase over since starting from April 2020. Washing hands by using soap can prevent various diseases because the hands themselves are the main carrier of germs, and the practice of washing hands by using soap can prevent 1 million deaths. It turns out that washing hands with soap has been proven to be able to prevent human transmission of the corona disease 19 virus or COVID-19, which has recently become a pandemic in various countries. Next. And material analysis data and method in this research. The type of the research in this study is using analytical. The research design use cross-sectional. And conduction on 1st May until 2nd June 2020 in the working area of Public Health Center located in Panjang District, City of Bandar Lampung, Lampung Province, Sumatra. Independent variable is the level of knowledge about washing hands with soap, and the dependent variable is the behavior of washing hands by using soap in the prevention of COVID-19. The population in this study was all households in the work area of Panjang Public Health Center in Bandar Lampung City, covering up to 1,197 families. And the research sample was 307 families. The samples were taken using the simple random sampling technique. And the data collection technique was done by distributing the questionnaire directly to the respondent. The data collected in this study were analyzed by using univariate and bivariate. Next. And the result, we can watch the table 1. Based on the table 1 of the knowledge variable, it can be seen that 307 respondents mostly had good knowledge, namely 206 with 67.2%, while the other 101 32.8% respondents were classified as having bad knowledge. Based on the table 2, it is known that of the 307 respondents, 97 respondents who wash their hands with soap is categorized as not good, while the number of respondents who had applied the good behavior in washing their hands were 2,110 respondents. And distribution frequency of the relationship between knowledge with hand washing by using soap behavior in the working area of Panjang Public Health Center in Bandar Lampung City in 2020 from 307 respondents, 50 respondents who have knowledge of hand washing by using soap had bad behavior in washing hands, while 47 respondents who did not have good knowledge about hand washing by using soap did not have a good behavior when washing hands by using soap. From the statistical test, results obtained were p-value 0.05, namely p-value is 0.000, which means that there is a significant relationship between knowledge and the behavior of washing hands with soap. In other words, behavior of washing hands by using soap is influenced by knowledge, and it can be interpreted that respondents with had knowledge have a chance of 4,111 times to have bad hand washing behavior compared to respondents who have good knowledge of hand washing by using soap. Next. In discussion, according to Nota Atmojo, knowledge is the result of knowing and occur after people sense a certain object. Sensing occurs through the 5 human senses, namely through sight, hearing, smell, taste, and touch. Most of human knowledge is obtained through sight and hearing. Knowledge is the result of human knowledge of certain object or material that has previously been studied. Knowledge can be realized when understanding is done by means of perception, either through the sense of through reason and mind. It is better if the Bandar Lampung City Health Office can encourage further about how to wash your hands with soap properly by working with Panjang Public Health Center. It is hoped that the Public Health Center will provide information to the public about washing hands with soap with presentation, public lecture, simulation. Meanwhile, the media then can be used or posters, leaflet, brochure, magazine, newspaper, flip chart, sticker, and pamphlet.
Mr. Nur Sefa, your time is
Next.
1 minute left.
Okay. Conclusion. Respondents who are classified to have a good knowledge were 206 respondents and 110 respondents were still categorized as not a good. Respondent with a good hand washing behavior by using soap were 201 respondents, while those who were not good were 97 respondents. There is a significant relationship between knowledge and the behavior of washing hand by using soap in the Panjang Public Health Center, Bandar Lampung City, Lampung work area in 2020. Next. Okay, thank you. Thank you for
very
listening.
much.
I'm talking it back to moderator, Miss Nisa. Thank you.
Okay, thank you very much for Mr. Nur Sefa Arief Hermawan for presenting the influence of knowledge to hand washing behavior in the prevention of COVID-19. And now we continue with the last participants in this session. Participant number 14, Dewi Yuliana and Radela Hervidea proudly presents to presenting the research. The title is The Influence of Peer Education on Sadari Self-Breast Examination Behavior in Preventing Breast Cancer for Women in Childbearing Age in South Lampung, Indonesia. To Miss Dewi Yuliana and Radela Hervidea, the times is yours.
Okay, thank you, moderator, for this opportunity. I will to introduce myself. I'm Dewi Yuliana from University of Mitra Indonesia. Today, I will explain my presentation about the influence of peer education on Sadari self-breast examination behavior in preventing breast cancer for women of childbearing age in South Lampung, Indonesia. Next. Cancer is the second cause that contributes 30% of death from 22 of death from main non-contagious disease after heart and vessel blood disease. One kind of cancer that often attacks especially women in breast cancer. Breast cancer is usually found in 40 until 50-year-old women, but recently it is found in the age of 80 years. Based on World Health Organization data in 2030, next. Oh, previous slide, please. Previous slide. Based on World Health Organization. Next. Previous slide. No, previous. Next. Four slide. Five. Five slide.
Okay. Okay. Is it right?
Yes. Yes.
Okay, please.
The breast cancer disease in South Lampung Regency is second highest number after Banda Lampung. The breast cancer case at Karanganyar village is not as the highest case in South Lampung Regency in 2000. Next. According to Romley 2011, the cause of breast cancer is not certain, but there are several risk factors for breast cancer, including internal and external factors. Internal factors include family, history, the influence of the hormone estrogen axis, to early menstruation, not married, not breastfeeding, and lead exposure. To limit public knowledge about the danger of cancer, early sign of cancer, risk factor for cancer, how to deal with the properly, and familiarize oneself with a healthy lifestyle. Next. Next. Next, please.
Okay, waiting for a while because.
Okay. Next, please. Waiting for
Maybe
a
you can
while.
continue while we're waiting for the slide.
Okay.
You can continue, please. Dewi Yuliana, please continue.
Based on the background described above, the importance of breast cancer prevention effort. This study aims to observe on the effect of peer education of BSL behavioral in breast cancer prevention in fertile age women in South Lampung, Indonesia. The next are material and method. Yeah, this study used a pre-experimental design method. The research used one group pre-test, post-test design. The population in this study were 158 people. Sample taken were 32 people according to the inclusion and exclusion criteria using random sampling technique. This research was conducted by 10 until 80 June 2020. Data was gathered through questionnaire by using questionnaire sheet and observation sheet. In this study, univariate analysis was used to determine the frequency distribution of each variable, and bivariate analysis was performed to determine the relationship between variables. Bivariate analysis use the t-dependent test with a significance level of 0.05. Okay, the next is result. Based on the table, the pick one. 30 slide, please.
30?
Yeah.
30.
Okay, yeah. Based on pick, yeah, 30. Thank
30.
you. Yeah.
The
Based
slide
on
until 1990 slide, but you say 30. Maybe you mean 13.
yes.
Okay, please.
Okay, based on picked one, it was found that based on age, the most number of the respondents are 26 until 30 years old. As many as 10 respondents. Based on the education level, most of the respondents were high school or vocational graduate. As many as 60 respondents, while based on occupation, 90 respondents were housewives. Next. Next. Okay. Based on Table 1, it was known that the average value of the respondent knowledge about breast cancer before health education was given 2.72 with a standard deviation. The result obtained a p-value of 0.000. Therefore, it can be concluded that there is influence of knowledge on breast cancer prevention before and after peer education was given the woman of childbearing age in South Lampung, Indonesia. Next. Based on Table 2, the statistical test result obtained a p-value of 0.000. Therefore, it can be seen that there is influence of attitude on breast cancer prevention before and after peer education was given to women of childbearing age in South Lampung, Indonesia. Next, conclusion. Okay. The conclusion is this study shows that there is an effect of peer education on BSA behavioral in breast cancer prevention in childbearing age women in South Lampung, Indonesia with a p-value of 0.000. Based on the result of this study, it can be suggested that women of childbearing age should be given health information about what to do prevent breast cancer by using various available health information media. Women of childbearing age should be able to practice regular breast self-examination in their daily life so that they can detect abnormality in the breast early and prevent breast cancer. Thank you. I think enough for this presentation.
Thank you very much for Mrs. Dewi Yuliana and Mrs. Radela Hervidea from Mitra University that presents the influence of peer education on Sadari self-breast examination behavior in preventing breast cancer for women of childbearing age in South Lampung, Indonesia. And now please write down your questions in column chat if you have a question for some presentation that given. For the first questions in this sessions to Dr. Linda, I know that you have already answered the question, but I ask you to explain again so that the others can listen the point that we got. To Dr. Linda, according to your research data, what is effective strategy to increase public awareness to implement the COVID protocol? Please, Dr. Linda, answer the questions. Dr. Linda, are you still there to monitor our conference? Okay, maybe I will read the answer from the chat. Dr. Linda says that thanks for the question for Mr. Ahmad Maftukhin. Effective strategies in increasing public awareness of implementing health protocols by empowering the community participations in helping to decide the spread of the coronavirus, such as providing hand washing and in front of the hand washing in front of the house, using masks during activities, delaying activities by inviting large number of people. If still done, keep your distance, mobilize cadres in the community, and often carry out health promotion by health worker. That's the questions and the answer. Maybe there are still have questions. Let me see. Oh no, I think it's enough for the discussion session, and we will okay. Again, Dr. Linda, maybe you will explain about the questions and the answer. Dr. Linda. Okay, I think Dr. Linda maybe go to the restroom. Okay, ladies and gentlemen, before we end our sessions, I would like to remind you to fill the presence link on the link that the committee has shared in the Zoom chat. And I would like to thank for all presenters and audience for good participations in these sessions. Hopefully these presentations will give us benefit. Thank you for attention. Please everybody turn on your video. We will take a picture together. Everybody, please turn on the video. Once again, for everybody, please turn on your video. We will take a picture together for these sessions.
Okay, I will take a picture, so please keep your best smile for me. I will count. 1, 2, 3. Wait. Okay. Wait. Again. Wait for a while. Okay, I will count. 1, 2, 3. And then once again, 1, 2, 3. One, 2, 3. That's all. Anna. Okay.
Okay, thank you for all, for your picture, for your video. Do not forget that we will return on 12:15. And I want to apologize for all my mistakes to operate these sessions, and I would like to thank you for all. Thank you for your attention. And I want to give you some information about Strada before I end our meeting today. I would like to share information regarding the registrations of new students of Strada Indonesia Institute of Health Sciences. IIK Strada Indonesia have 3 faculties, namely Faculty of Health, Nursing, and Postgraduate. In the Faculty of Health, there is a study program Diploma 3 Radiology, Bachelor of Public Health, Bachelor of Pharmacy, and Bachelor of Hospital Administration. In the Faculty of Nursing, there are a Bachelor of Nursing, Nurse Professions, Bachelor of Midwifery, Diploma 4 Midwifery, Diploma 3 Midwifery, and Midwifery Professions. In the Faculty of Postgraduate Study, there is a Master of Public Health and Master of Nursing. More fully, you can access through the link http://iik/strada.ic.id. Ladies and gentlemen, finally we are come to the last sessions. Before I end, let me ask you for forgiveness for all mistakes that I make, and don't go anywhere. We'll be back on 12:50. Thank you very much. Good evening and see you in the next conference.